Lori Vaness and her grandmother Doris Wisely share a special bond. She raised Lori after her mother died. Since March, they've been kept apart, with her 98-year-old grandmother confined to a room at Carrara, a Plano nursing home and rehabilitation center.
This is the longest I've ever been apart from my grandmother since I was born.
While dropping off items for her grandmother, Lori says she was shocked to learn the facility planned to take in COVID-19 positive hospital patients.
I was appalled, absolutely horrified, and this is just unacceptable that the government is allowing this to happen.
Statewide, it's unknown how many nursing homes are admitting COVID-19 patients, but when WFAA tried to find out how many nursing homes actually take in COVID-19 patients, we discovered something we think you should know. The state of Texas does not require nursing homes to report that they accept COVID-19 positive patients from hospitals. In a statement, Health and Human Services officials told us there is not a specific requirement for nursing facilities to report whether they are accepting COVID-19 patients from hospitals. When we began looking for nursing homes that had designated COVID-19 wings, state and county officials confirmed there are more than 24 facilities in North Texas, and at least 9 of those facilities received a 1 or 2-star overall rating out of a possible 5 stars by federal regulators. That means those nursing homes were considered below average or much below average based on a federal review of staffing, quality control, and health inspections. So we looked up Carrara, the facility where Lori's grandmother lives. It has a 5-star or much above average rating.
I'm sure there are facilities that could pull this off. They're well funded, they're well staffed, they're well trained, and those should be the ones who are identified by the state as facilities that should be doing this.
Attorney J.T. Bora specializes in nursing home abuse and neglect cases. He's concerned Texas regulators failed to proactively review the track record of nursing homes for quality and infectious disease controls prior to being allowed to open COVID-19 wings.
But just letting anyone or any facility do it who simply wants to do it without demonstrating an ability to properly care and contain the virus is irresponsible.
Back in late March, New York Governor Andrew Cuomo was criticized after he issued a directive ordering nursing homes to accept medically stable COVID-19 positive patients. Cuomo's directive cited an urgent need to expand hospital capacity. Under pressure, Cuomo reversed course during this press conference 6 weeks later.
Hospitals, going forward, cannot discharge a patient to a nursing home unless the patient tests negative for COVID-19.
In a statement, a Texas Department of Health and Human Services official told us, in order for a nursing facility to be a designated COVID-19 facility or offer a dedicated COVID-19 wing, that facility needs to be able to cohort or separately group residents effectively, have sufficient staffing and sufficient personal protective equipment.
Texas still ranks the worst in the country when it comes to overall quality and safety for nursing homes. It just, hands down, it does.
Former nursing home regulator Brian Lee is largely correct, with Texas at or near the bottom in reviews ranging from Care.com and Becker's Hospital Review to Forbes and Baylor University reports.
They need to get their arms around this. They need to get involved right now.
Texas Healthcare Association CEO Kevin Warren disagrees with Brian Lee.
I mean, you're talking about a profession that's one of the most highly regulated professions in the country.
He says providers are stepping up to help the communities they serve.
This is the type of step that facilities are willing to take in order to be partners in the community and help fight against COVID that is affecting everybody.
Carrara, where Lori's grandmother lives, is owned by Cantech's Continuing Care Network. The company also operates a COVID-19 unit at its Windsor Gardens facility in Lancaster. Robin Underhill, the company's CEO, said in a statement, Cantech's Continuing Care Network rose to the challenge when our community needed us to serve patients, their loved ones in the larger Dallas area. The company says both facilities each accepted more than 40 COVID-19 patients in August. The company also said these units have protective doors and only staff working in the unit are permitted to enter. Those staff do not enter or interact with other parts of the facility. Last month, state officials announced that limited visits would be allowed at long-term care facilities with no COVID-19 cases. But state regulators confirmed that any facility taking in new COVID-19 patients cannot allow visits. So for Lori, that means she still can't see her grandma anytime soon.
I'm just scared to death that it is a death sentence, and the only way I'll be able to see her right now is if she's actively dying.
In Dallas, I'm Tanya Iser.